Paola, can you hear me?
Yes, we can all hear you.
All right, but I don't have an image. What the hell is this?
Are you on your phone?
Yeah.
Oh, yeah, I don't know how to work that out.
All right.
We can definitely hear you.
All right. Well, that's okay.
You should have a video button right next to your microphone on your phone app.
No, I don't have one.
Unless your phone has to have a camera.
Yeah, but I don't know why it's not. It doesn't show up here.
Alrighty. You ready to go, and all your panelists are set up to unmute themselves and share anything that they would like on the screen. So there's no need for me to do anything on my side. You're ready to go.
All right. Let me just see if we have a quorum. All right. Is Betty here? Tanya? Daryl?
I'm here.
Tanya's here. Daryl? Catherine?
I'm here. Good evening, Stephen.
All right, thank you. Naisha? Sally? Barbara?
Sally's here.
Barbara?
No, not
Osi?
yet.
Jay?
Not yet. If you don't see them on the participant screen, they're not on the call yet.
Oh, yeah, hold it.
Paula?
Yes?
Did we have WebEx last time?
You had Zoom last time, so you're alternating.
We're alternating? Oh, okay, cool. All right.
Yeah, I don't think we've had WebEx in a long time for our committee. But there's only 3 of us right now.
Seems like Zoom is better, no?
That's why they're trying to get 2 accounts, so we got to bear with WebEx while we can. Especially because there's another committee tonight, otherwise you would be on Zoom.
I can't see the list of participants.
We can assist you with that, and you have a couple of members that can see the list and they can help you with that as well.
Yeah.
Steve, do you see the top right-hand corner of your screen? The top right,
Oh,
it looks like a
okay.
person. If you click
Okay,
that,
yeah,
you'll see
okay.
the participants. Yeah,
Thank you. Okay,
you're
thank you.
welcome.
Thank you.
Tanya, since you're on the same device as him, can you also show him where to turn on his camera, please, Tanya?
Sure. At the bottom, Steve.
One,
Um.
one, sec- hold on, one
At the,
second, one second.
oh, sure.
All right, so,
So you saw your participants, right? Okay.
yeah,
And
okay, I see Catherine, I see Sally, I see Tanya. I don't see any other committee members.
yeah, I don't either.
Uh, gosh.
And they know we're at 6:30 now, right?
Yeah, I mean, and Darrell was the one who insisted it should be at 6:30.
Well, if you go to the bottom, Steve, at the bottom of the screen, you see a
Yeah,
microphone, right?
no, I see a thing that says chat and another thing that says raise hand. Oh, should I,
I think is it possible that you have? Does everybody have the same version of this WebEx? Is this not like some people have a different login or something where they have access to different things? Paula, is it?
Excuse me, he's casting it out of the participant list by hitting the back arrow. And that will take him back to the microphone, the camera, the dots, and the X.
Okay.
Steve,
Thank
do you have that?
how do I get to the camera?
Hi.
Okay. Re-click, click on the participant list again. That will close it. Or hit
Close
the,
What?
you want to close the participant list.
Yeah, I did that.
Okay, but at the bottom of the page, do you have the microphone? The
No.
camera?
Oh, yeah, I got a microphone, yeah.
Okay, next to the microphone is the camera. Click on the camera.
No, next to the microphone, I have 3 dots. I don't have a camera. All right, we'll have to live without it. Okay, Darrell is now with us.
Yeah, Steve. Hi, I'm here, and I have Jay Mazer on the phone. So hold on a sec. Okay, sorry. We're figuring out some technological stuff too.
Okay, well, once Jay gets on the call, we have a quorum.
I see a phone number on here. Darrell, is that Jay?
Oh, gosh.
I don't know who that phone number is now. Sorry. Is Paula on?
Yes, I am. Otherwise, the call wouldn't be on. How can I help you, Darrell?
We can't do anything without you. No, I was wondering because this WebEx thing is different, but
Yeah, unfortunately, I cannot troubleshoot for anyone, not even for someone that's already showing up on the list. There's nothing that I can do.
yeah, no, I know, but I was wondering if this was the last time we're using this because I know the Borough President's Office had a meeting and that.
I have no idea,
the need
but
for this app.
maybe you guys can discuss this offline with the chair.
Yeah.
Okay.
Yeah, let's do that some other time. All right. we're
I
gonna have
can't
to
hear
start.
anything. Daryl, are you speaking?
All right,
I was. You can't hear me, Sally?
All right, listen, we're gonna have to start because
Betty is on. Betty is on. We have a quorum.
Okay, good. We have a quorum. Okay, so we're calling this meeting to order at 6:39, and we're gonna lose the people from Presbyterian in about 20 minutes or so. So they want to begin by showing us I think a 40-second clip of showing us the operation at the Fort Washington Armory.
Thank you, Steve. Actually, I think we will skip that just in light of the likely technical difficulties. What I will do is put a link in the chat so people can visit that website where the video is available on their own time.
All right, thank you.
Sure.
All right, so you have a report to give us about the current operation at the vaccination site at the Fort Washington Armory?
That's right. Thank you for having us here today. So for those who don't know me, I'm Anna Garcia. I'm Director of Government and Community Affairs. And I'm joined today by Ann Sperling, who's our Vice President of Government and Community Affairs. I'm actually going to first turn it over to Joe Iannuso, who's our Senior Vice President for Facilities and Real Estate. And Joe is really responsible for setting up the magnificent setup we have at the Armory for these vaccinations. So Joe's going to give just a quick overview about what that setup is like and what we've accomplished. So Joe, I'll just hand it over to you.
Thank you, Anna, and thank you, Steve, for the opportunity to both respond to questions and provide an overview of what we've tried to accomplish at the Armory. Let me start by saying we're certainly grateful to the Armory Foundation for their partnership in providing access to that site. And I don't mind telling you how quickly we worked. The specific dates have all blended for me at this point, but I know that we fully signed an agreement with the Armory Foundation on a Sunday. We committed to not disrupt the athletes that were training there on Monday. So we really just walked the space continuously to come up with the flow plan. And I'll talk through that a little bit. And we did the physical setup on Tuesday, and we actually started vaccinating patients on Wednesday. So we moved just about as quickly as we could. Many of you are familiar with the Armory space, and one of the reasons we thought it would be advantageous, not only because it's located in Washington Heights and could help us serve the community of Northern Manhattan, but we, to the best of our ability, wanted to make sure that we could queue patients within the building as opposed to on the sidewalk. You may have noticed that we worked with the Armory Foundation. There was already a sidewalk bridge up on Fort Washington, but we extended that bridge up West 169th and also up the ramp to the upper level of the Armory field. And I'll talk a little bit more about that as well. The reason we did that, not that we don't have a crystal ball, but we did know it was going to be cold and probably wet. And we certainly didn't want to rule out snow. So I'm very glad that we did that. In thinking about the Armory, we preserved the Fort Washington entrance, which is, as you know, ADA accessible. And I do want to thank Edith for her note, which Ann and Anna passed along to me. And I want to reserve a few minutes to address the issues that Edith had raised in her email.
Well, let me just interrupt for a second.
Please.
Joe, are you going to be able to stay beyond 7 o'clock when Anna and Ann have to leave?
I am not going to be able to stay beyond that, Steve. But if you want to read
I can actually, yeah, I'm sorry. I can actually stay on when Joe has to go, and Anna will cover for me at the next thing. So one of us will stick around.
All right. Okay. Thank you. Okay. All right. Then I don't feel under as much pressure. All right. Thank you. I'm sorry, Joe, go ahead.
Yes, thank you, Steve. So we reserved the Fort Washington entrance for, I would say, clearly mobility impaired members. And that was certainly we intended wheelchairs and walkers. And as you may know, there's only one elevator in the Armory. And given the volume of patients we anticipated, which is clearly exceeding 2,000 vaccinations per day on average, and those numbers will grow over the coming weeks. We worked with the Armory to take advantage of the ramp on 169th that clearly, we characterize that as the walking well. But when you go up that ramp, and we added handrails to both the up and the down side of the ramp, as well as radiant heaters to take the chill out as best as we could. But when you walk up that ramp, you're actually on the field level. So it is working out pretty well. And what I want to do is to shift for a minute just to the upper level of the field, and then I want to address Edith's questions. When you enter either the Fort Washington entrance or
one sec, we're getting feedback here.
Please mute if you're not muted.
That's better. Thank you. So either at the Fort Washington entrance or the 169th Street entrance, what we did with respect to structuring the queues is really have everyone who enters really proceed in a circle, if you will. So you enter, and we have to solve three problems during vaccination. One is registration, which is critically important because we have to get basic information on the patient and associate the patient with the specific vaccine, Pfizer or Moderna at this point. The patient then proceeds to vaccination, where they actually receive the dose, and then they have to proceed to observation, and they have to be watched for either 15 minutes or 30 minutes, dependent on their medical history. So in solving for those three issues, we really want a fairly straightforward flow where patients move in one direction, proceed through the three distinct phases, and then are able to exit. We do that, of course, at very different scales on the Fort Washington side and the 169th side. Given the volume of patients we're dealing with, what the 169th Street entrance provides us is the ability to really queue almost everyone within the building. In very few instances have we actually had the need to queue folks outside. So I'm going to pause there, and I do want to go through the issues that Edith has raised. And I'm going to try to take them in the order that Edith observed them in the email. The first was on the Fort Washington side, there were some barriers that were, I think, on the first couple of days. I would agree with Edith that they were maybe causing a little bit of confusion with respect to passengers leaving the buses. Partly because, I think there could have been some better communication even with the MTA, even though we tried to do that. That issue has been resolved. I will tell you, any issue we have is going to require constant attention. So it's not that anything we're going to talk about is, resolved once and then we don't pay attention to it. We're going to have to continually monitor all of these issues. And I was at the Armory a good part of the day today, and I did observe that things seem to be moving very well at the bus stop. With respect to patients entering the Fort Washington area or attempting to enter Fort Wash and then being redirected to 169th Street, that certainly has happened on occasion. Even though we're dealing with
what we're talking about in this connection, people being redirected who are either in wheelchairs or mobility impaired, people who should be entering at the Fort Washington entrance and who should not be redirected around the corner.
Steve, I would agree with you completely. If anyone is in a wheelchair or walker and being redirected, that is not the way that we intended this flow to go. So we will continually monitor that, but that is not what was intended by any means.
And that's,
so
that's because you set up a couple of stations in the lobby where people in wheelchairs could get vaccinated, so they wouldn't have to go upstairs. Isn't that the case?
You're absolutely correct. The lower level of the artery is set up specifically for wheelchairs. If folks may want to tell us back up,
if somebody
mute yourselves, please.
If somebody talking, please mute.
Steve, you're absolutely right. The lower level is intended specifically for wheelchairs and walkers. And our sincere apology if anyone in a wheelchair or walker was redirected. But it is a very high priority for us, and we will continue our due diligence on that on a daily basis. The next issue that Edith mentioned was, and Edith's observation is absolutely correct. We did have initially golf pencils, which are very small pencils, much smaller than the typical long yellow pencil with the eraser on the end. We did go with the golf pencils initially because we could get them in volume, and it was our objective to not ask folks to reuse any of the pencils, but just leave with it. We will have, and I think we probably do even today, have regular full-size pencils available for those who need them as well. Edith also mentioned that some of the printed forms were in, I think Edith specifically mentioned the 10-point font. I can't attest to 10-point, but I know exactly what Edith is saying. And yes, we're going to, those forms that we can control, we will actually have those available in larger font as well. And the last issue that Edith mentioned, and I very much appreciated Edith mentioning this because it was on our list, and that was to have some armchairs for those who would need that extra lift when they were exiting. And they were meant to be delivered last weekend, but the weather, of course, has delayed that. So they'll be coming either on Saturday or this coming Monday, February 8th. What I will tell you with respect to chairs, and if any of you have been in the Armory, there's a lot of queuing, which is serving us very well. But in some areas where we're queuing, we actually, we've arranged it so that our community members can actually queue while being seated. We can't do that in all of the areas, but we certainly do that at the entrance at the top of the ramp on 169th. And that also is serving us well, and our community members seem to greatly appreciate that as well. Steve, I will pause there.
Thank you.
And if there are any questions, I'd be happy to take them.
Yeah, let me just say that the setup at the Armory seems to work amazingly well. It's incredible that you were able to figure this all out within the space of a few days, unless you've been planning on this as some kind of contingency plan for a period of time. The idea that you might have put this together in just 3 days is really amazing. People do, once they get there, they only have to wait a short period of time, and then they get online, and the line just keeps on going. So I want to thank you for the work you've done there. Are there any specific questions for Joe about the setup of the Armory itself? Because I do want to move on to some of the more significant questions.
Steve?
Yeah, who is this?
Edith?
Edith. Yeah, Edith, please. Yeah, go ahead.
Okay. I'd like to point out that people with mobility equipment probably could negotiate 169th Street better than the walking wounded. The vast number of seniors and people with disabilities trying to walk along that somewhat hazardous sidewalk on 169th Street, up that ramp, which is not very well constructed or maintained. The railing is interrupted by uprights, which makes it a little harder for people who actually need to hold on to the railing to get up the ramp. Does not work for them. I was very disappointed by the fact that when I spoke to people last week when I was waiting for my vaccination, it was like this total lack of awareness of what these issues were. The fact that there was nothing to lean on to fill in the form was also a problem. But the fact that the size of that font, the light quality in there is not so wonderful. When you got into, I'm sorry, the room where they're actually doing the vaccinations, the lines were like so circuitous that it was hard to stay on the line. I'm not suggesting you go out and find velvet ropes, but there may have been something that could have been done to make it a little more consistent.
Well, Edith, we certainly appreciate your observations, and your email contained a number of action items, which again I want to tell you that I agree with, and almost all of them have been resolved at this point. With respect to some of the other challenges that you mentioned, we've made a lot of improvements within the Armory. I do think that the ramp is absolutely challenging for some. We do have wheelchairs on standby, both downstairs and upstairs, and we use them on a frequent and certainly on an as needed basis. Our team members have also accompanied those who need assistance the ramp whenever that's possible. I think and as we know, the eligible population at this point is 65 years and older. But at some point, we expect that eligibility criteria may change. And I think some of these issues may become less challenging as we proceed forward. But I do agree with the observations you've made. I don't really agree with the fact that you feel that these are things that we didn't take into consideration. I'm disappointed if that's how you feel, but I want to let you know that we're going to continue to do our absolute best to make this as pleasant an experience as possible. And a lot of our folks who are leaving that site are leaving exuberant, having had a positive experience. But I do appreciate your observations.
Steve, I had just a quick question and a comment.
Darryl, go ahead.
Or actually, I guess they're both comments. One, I work for the City Commission on Human Rights. We use a 16-point font for any external flyers, so just that may be a good guideline for you.
Thank you.
And then, Mr. Chairman, just two of the phone numbers are Jay Mazer and OC, just so you know.
All right, thank you.
Steve, I'd like to comment.
Who is that, Barbara?
Barbara, yes.
Go ahead.
I comment as a committee member, but I also got my first vaccine on Saturday. My experience, I found it to be quite good. Some of the issues that Edith raised, I found that I was offered assistance verbally every step of the way. For example, when I came down 169th Street and got to the ramp, I was immediately asked if I would like assistance. I didn't need any assistance, but one of the guards or one of the volunteers there said, "Would you like some assistance?" And I said no, and they smiled and said fine. And then when I got in there and I was given the sheet to fill out, they asked, do you need any assistance filling out the sheet? I said, no, thank you. Also, I point out with the sheet that you have to fill out, most of the back side of the sheet is empty. So there's plenty of room to increase the font size and still keep it on one sheet of paper. So that would be an easy fix, okay? The other thing is that in terms of going through the circular situation, when I on Saturday, there were many volunteers with red paddles who were directing you every step of the way. So it was very easy to know where to walk and what the next direction or spot was to go to. So they were just constantly kind of herding and waving you along with the red paddles. And some of the paddles said on them, "Habla Español," so that you knew that you could find someone who would speak Spanish very easily and very quickly. I thought that was a very good touch, I also wanted to comment that the nurses were very well trained to ask if you had any questions about the vaccine, anything you wanted to clear up, things. And I did have a few questions that were very, very well addressed, when I got the vaccines. Overall, I think it was very excellently run. And overall, I could see people were very, very well pleased. I do have one question. For example, a neighbor of mine who will hopefully be coming next week has sciatica, and there's no way she can walk that whole circle. Do you have wheelchairs available? Like her husband can drop her off at 169th, but do you have wheelchairs immediately available at the ramp so that she could then be wheeled up? And I think you're going to have many older people where you should have wheelchairs immediately visible and available there so you could offer a wheelchair to anyone.
Barbara, thank you for that. We do have wheelchairs available at both entrances, Barbara.
I didn't see any on Saturday.
Yeah, no worries. We can make them more visible. I think that typically we keep them at the top of the ramp, but I get your point, and we could certainly keep some at the bottom of the ramp so that folks know that they're available.
Yeah, maybe even with a sign, wheelchair available, some kind of signage, and have them available at the bottom of the ramp. I think that would be an important improvement.
Thank you, Barbara.
Okay, Anna wants to speak before she goes. Anna, go ahead.
But bravo, basically, you're doing a great job. Bravo.
Anna?
Thank you, Barbara. I know Joe has to go, and I did just want to take a moment to move the conversation on to the questions around the education we're doing for the community so that people know about how to set an appointment. Is that all right?
But Joe, if you're still with us, don't go yet.
I'm still here, Steve.
All right, go. Okay.
I have a question. Can you hear me?
What? Can we let Anna speak?
All right.
So I just wanted to share with you, because Steve had asked us before the meeting to talk about the education we're doing and outreach to the community so that they know about the appointments that are available. So I just wanted to lay out that we've got 2 tracks of education that we're doing for the community. One is about the vaccine. So we have developed presentations that can be shared in multiple languages: English, Spanish, Chinese. We are now translating into Haitian Creole, that provide information for community members about the vaccine, about the disease. It helps answer a lot of frequently asked questions about the vaccine. So this is a resource that we have available, and we have a faculty of about 30 physicians and other clinicians that speak multiple languages that are interested in coming out to the community and talking about the value of the vaccine and answering your questions. So if anybody is interested in a presentation about the COVID-19 vaccine, please just reach out to me. We are very happy to set up a personalized, targeted educational experience for you. It could be your housing a tenant association, a civic group, an employment situation. We're very flexible and very interested. Secondly, we have been working with community-based organizations, including senior centers. I see Betty Lehman. We're working with Isabella. We've worked with Uplift. We've worked with a variety of organizations to train them to make referrals directly to us. This allows us to bypass the online appointment setting system and instead work through trusted partners so that senior citizens who we understand have difficulty navigating the online appointment setting system, it allows them to sort of work with their community partners that they're used to working with to get an appointment at the Armory. We've been doing this for about 3 weeks, and it's been tremendously successful. We think we've really improved the ability of local residents to get an appointment and to be seen quickly at the Armory. So I know Steve had some questions about that, so I wanted to be sure to lay that program out for you. We've done training. And so we have another training tonight for a group of community physicians, and that's the meeting that I need to get to. But did you have a question you wanted me to answer, Steve?
Well, I think it's great that that you've reached out to incorporate all of the CBOs, but I think our basic issue is that a lot of our seniors are not affiliated. They may not be reached through this
Sure.
process. You're going to reach many, but you're not going to reach everybody we need to reach. And I think we need to have a easier, quicker system, a place where people can just walk in, ask for an appointment, and get an appointment on the spot. And if you can't if you don't have room at the Armory at this point, I was thinking, let's reopen Coogan's. You got an huge empty space at Coogan's. Let's use Coogan's. It's right there. It's visible right on Broadway. Let people know that they have a chance to get an appointment by just walking in, and they can be served right away. I think that'll alleviate a lot of the frustration that I'm hearing from people who can't get through the website or whatever, and who go to the Armory. They don't know if it's a crapshoot whether they're going to get it. Sometimes it seems as though you're accepting walk-ins, sometimes you're not, and people don't know what to expect. Let them just go to let them know that there's a place they can just walk in, get an appointment, come back in another couple of days, and get the shot.
So Steve, I actually think we can do one better on that, because we totally agree. And just to take a step back, I know everyone's been following this closely. We actually opened on, I do remember, Joe, the date, January 14th. It's like emblazoned in my mind. But, and since then we've done over 30,000 appointments at the Armory. So because of Joe's team and Anna's work, it's been really amazing. But we also do recognize, and, you mentioned, Steve, the media from last week. So I want to just quickly acknowledge that and get to the sort of bigger point around helping people who may not have sort of a relationship with the CBO or other access to get an appointment. But, we really did start from day one, as Anna mentioned, working with these community partners, educating them, helping to get people in through a portal where they could help register their constituents or seniors. And we were actually setting aside very significant blocks of our spots for local community residents. And yet, even with all of that, we saw after about a week and a half that there were a lot of patients who were coming in from outside of the community. And that is what some of the media sort of addressed last week. And I think we've all seen subsequently that there was coverage that this is a problem that is not about New York Presbyterian or the Armory. It's a systemic issue that we all want to address. And certainly we at the hospital feel passionate about. I feel passionate about it, Joe, Anna. And so at that point, which was last Thursday, we made a really significant sort of change to our guidelines. We said that no one from outside the 5 boroughs could get vaccinated at the Armory, and that a minimum of 60% of all of the people vaccinated at the Armory had to come from the local communities of Northern Manhattan, South Bronx, or Harlem. So that was last Thursday. I think since then, since that day, we've been at over 70% local patients. So it really has been a really significant change. I know we're really all proud of the work, but yet we know that there's a lot more work to be done. Of course, everything that we do is sort of, and I say this just a little bit of inside baseball, we are committed to being able to meet our appointments, which means that we are not going to make vaccine appointments if we do not have the vaccine available. I'm sure people have read the other media, right, where people had to cancel appointments. We do not want to do that. So that means that we are not scheduling out a week, 2 weeks, 3 weeks. So people do have to have a little bit more patience with us. Your point, Steve, just about helping people who may not have another point of entry. We've been working, this is not yet public yet, but I do want this group to know, it should be in the next few days. We are working on a phone line, a bilingual phone line that will be just for the sort of target communities of Harlem and Northern Manhattan and the South Bronx, where people can call and schedule appointments. We did actually think, Steve, very much about your idea and what could be a good space, but because it's the winter, because we're talking about seniors, and also just because of space constraints, it seems a lot easier to allow a person to just be able to make a phone call and schedule or leave their name than it does to require a person to walk in. So that is something that I'm hoping in the next week and a half or so we'll be able to operationalize. We will be staffing it with people from the community. So hopefully that's going to help to address a lot of those concerns about people who have no other access.
Okay, well, that's
Steve?
definitely a plus, and we'll definitely have to work with you to publicize it and make sure the word gets out so people know that they can take advantage of that. And let me tell you, having over 70% of the community, of the local people availing themselves of the Armory since last Thursday, that's a huge plus. But let me tell you, I think, and I'm not casting any aspersions on you or anyone else at the hospital, but I think it would be to your benefit if we had like weekly reports. If you could give us a zip code breakdown each week of who's getting the vaccines, so we can continue to monitor it, and we can all be reassured that everything is working out as it should be.
Steve, my
Steve,
question
I have,
is,
Steve,
I have a
I
question.
think
Well,
I think there's Tanya, OC, Barbara. Tanya,
yeah.
OC, Barbara.
Thank you.
Okay.
Thank you.
Well, can I first hear back from Ann about
Sure.
what she thinks?
Daryl, I also have a question. It's Sally.
Okay.
I just want to say something as well.
One second, please. Ann, do you think we could get those weekly reports?
I'll ask about what type of data we can share. I don't know at this point, so I'll take it back to our data and analytics team to see what might be doable. But I will tell you that it's been consistently over 70%.
Well, I think that's great, and of course, we're particularly parochial at Board 12 because we wanted to know about our particular 4 zip codes. We're not telling you not to serve people from Harlem or the South Bronx, but we do want to be reassured that you're getting the maximum number of people coming out of our own community.
So I can also tell you, and I don't have the data and statistics, that the bulk of that group is local. We also, we are very carefully looking at sort of the numbers and the demographic data, just in terms of how many people we have over 65 in Washington Heights and Inwood, so that we sort of are tracking and following the sort of dent we're making and the impact we're having. But I will tell you, I mean, it is the goal of our teams. We want every eligible person in Washington Heights and Inwood vaccinated. I mean, that is sort of the mission here and the goal.
All right, that's good to hear. All right, Daryl, who's next?
I heard Tanya, and then OC.
And
all right, Tanya.
Yeah.
I got you.
Betty would
Okay,
like something.
and then Sally and Betty.
Yeah.
Okay, very good. Tanya.
Yeah. Yes, thank you. Yes, I have a question about what kind of statistics you have in terms of the people that are coming. It's great that we are getting this more localized, but I wanted to know if you're breaking this down in terms of the people that are coming to get the vaccine. What do you know about those demographics? Like, because it's one thing to have an outreach and say, oh, we're going to have outreach locally, but if you look more closely at the statistics of people coming, if we are sort of lagging in a certain demographic, that might be an area where we might want to do more outreach or a different kind of outreach. And I think about this because when I talk about it, I think part of what happens in the media is they talk about Black and brown communities being similar. And I'm not saying that they are not also, impacted to the high degree, both of them. But there are differences in terms of the Black people, for example, in terms of their engagement with the medical community, with medicine and the historical, stemming back from slavery and all of that. And so, and it's Tuskegee experiments and things like that. So I just wanted to know if you knew anything a little bit more about statistically who's amongst this group getting vaccinated. Are we capturing the people like in Dyckman houses, things like that? And are we recognizing the need to sort of make some different outreach choices depending on the different demographics, because we all don't have similar histories here in America?
So I will get to that. I do want to let Joe sort of sign off here because I know he's got something else to get to, but as soon as he's
Well, I tell you, before Joe goes, Joe, could you just briefly tell us, is there any news about the status of the plans to construct a new building on Broadway between 169th and 170th Streets?
No, Steve. As a result of all of the impacts over the course of the last year, that project remains on hold for now.
Right, so it's on hold for the foreseeable future?
That's correct, Steve.
Okay, very good.
All right. Thank you, everybody. Good
All
to
right,
see you.
Joe, thank you very much for coming in.
Thank you, Joe.
My pleasure. Bye, Ann.
What about my question?
Okay, hold on.
I didn't get my question answered,
About
so, and I
Hold
was,
on. Everyone,
would
hold
like-
on a sec. So we have
No,
Ann is going to answer. Hold on, Steve. Ann is going to answer Tanya's question. Then
Yes.
we have Sally, Betty, Barbara on the committee. We have two non-board members who aren't on the committee who would also like to ask a question. And then we have someone from the public. Okay.
Okay. All right,
So-
but didn't you
So I
also
should
tell
get
me?
comfortable. Is that what you're saying?
So yeah, did you need a cocktail or something?
Okay,
But
what about
yes.
OC? Did
Yeah,
I'm on the
yes,
committee now.
OC is after Ann answers Tanya's question.
Okay, okay,
All
very
right.
good.
So first I'll answer the question about race and ethnicity data, which we absolutely are tracking. To tell you a little bit about me, I actually come out of the city health department. I have a master's in public health. So this is like, actually I've been at as Steve knows, I've been at the hospital 6 years. I've never been more exhausted, but felt more engaged and energized by my work than I have over the past 4 months when we've like really tried to sort of begin to tackle this issue of vaccination and address some of these disparities. So we are tracking that data. We actually launched about 6 months ago the Dalio Center for Health Justice, which was part of a gift from Ray Dalio, $50 million. It's led by an amazing physician. I think she's presented to this group before, Julia Yashara. But one of the things that Julia is really focused on is making sure that we're really capturing our race and ethnicity data well. We know that that's a consistent problem. People don't want to give it. And so if we don't have the data, it's even harder for us to track it. We have a campaign called We Ask Because We Care. Now in the Armory, we're really, making sure that that sort of messaging is around and that there's a wide variety of people who are checking in, asking the questions in a culturally competent way so that we can make sure that we don't only have the data, but that the data is in fact accurate because it's not missing a large. But I will say that in addition to the 70% coming from the community, are sort of the proportion of people that are Hispanic and that are Black have also increased concurrently.
Do you see a trend? I just wanted to follow up. I'm sorry, because I really think this is important because I really cannot stand when people throw in these minority quote unquotes together as if we all have the same, that outreach is going to work for one, will work for the other. So that's why I'm asking, like, how are you going to address like the different ways to outreach about this vaccine to different communities that and not throwing everybody in the same pot, because what will work for Hispanic community outreach is not going to work for Black folks.
100%, and we've seen that from the data just in terms of what people respond to, and there's been a lot of surveys. That's what Dr. Yash has been digging into. Also, one of the reasons why we have a really dynamic and diverse speakers bureau. We have a lot of people who are like, don't send a white doctor to our church. And we fully recognize that it's not appropriate, right? People want to hear from someone who is from their community. So we're trying really hard. And again, I'm going to sort of defer to Julia. I'd be happy to bring her back to one of these meetings because she really is the expert. And she's really spent a lot of time making sure that the messaging to different communities is tailored for that community. And it's also, as we sort of move forward as a society in New York, the people who are delivering the messages are the right people. So for us at the hospital, we've actually had very amazing vaccine uptake in terms of our own staff, but we still do see certain staff populations who are a little bit more resistant. So we've launched actually a number of campaigns where people are really, we essentially have vaccine ambassadors because we know for certain folks, it's really that one-to-one conversation. And telling someone that what they believe is a myth, we know doesn't work, right? It's about listening and sort of understanding what someone's concerns are. But fully get your point that I would argue that not even every community is different, but people are different, and there is a lot of sensitivity that has to go along with delivering the message.
Yeah, well, when you give us the zip code breakdown on the people getting vaccines, we would also like to see the racial breakdown, if that's also available. OC, you have a question?
Yeah, I have, it's actually more a comment. I would like to know, that's actually a question, Steve. It will be good to know how many Inwood, Washington Heights residents got the vaccine before Columbia Presbyterian was put to shame for allowing that. So that will be a good number to know. So then we will find out how many of our community members missed that opportunity to get vaccinated because Columbia Presbyterians, kept it quiet. And the other comment that I would make is that it's it's really shameful that no outreach was done. Just what Tanya was talking about was very important right now, and nothing was done. So we needed the media to come out and make this discovery in order for Columbia Presbyterian to change the way they do the vaccination. You know what? I'm sorry to say that, and it's nothing to do personally. Shame on you.
All right, well, that's definitely in the range of a comment. Sally.
Yeah, I just had a question. I think Joseph referenced this earlier, opening
I think that I deserve a comment from Columbia for what I just said.
Sure, I'm happy to respond. I mean, honestly, we tried, and I say this wholeheartedly, we tried from day one to do everything that we thought was the right thing to do in terms of building community partnerships. And, I know some of those partners are on the phone. This is from day one, not, day 5 or day 15. Making sure that we were setting aside a quarter to a third of our spots. And we recognize that even doing all that, there are significant systemic problems where certain populations have advantages. And because of those advantages, they were able to access vaccinations at the Armory at an outsized rate from our local community. And when we realized that, and I would also argue that it wasn't because we were put to shame. And, I certainly don't feel any shame for the work that we did. We, really quickly tried to set something up that we knew would help New Yorkers. We're a hospital system, we're not city or state government. We are supporting this, on our own as a nonprofit institution because we believe it's the right thing to do. And so we immediately sort of observed that it is a learning experience, that even with all of our efforts, because of the systemic problems that we all know exist and that we all need to continue to do a better job of observing, myself included, and we course corrected. So I don't know sort of what else to say other than we acknowledge that we can always do better. There will always be feedback that enables us to do better. That's why we like partnering. But from day one, we have tried our best and we will continue to do so.
But I think, Ann, part of the problem has to be that you were relying upon the Connect portal for people to get their appointments, and people who are already patients or linked to the hospital.
That's incorrect. So as of the second day we opened the Armory, we launched partnerships with community-based organizations where they could direct, and senior centers. So we started working with ARC on, I think, day 2, where they could directly refer. So that was from the outset. So from the outset, we were taking big blocks of appointments off of the online system, saying whether they were ACN patients or patients for whom we had community-based relationships with, we have to have these appointments available for people who can't, the Connect, it's clunky. We all know it's a clunky system. But even with all of that,
really help our residents connect, especially.
Sorry, I thought I heard. Even with all that, there was an imbalance. So I think it tells us more about kind of world and things we all have to, and we're working really hard to address them.
Sorry, if you just joined us, please make sure you're muted if you're not speaking. Thank you.
All right, thank you, Daryl. Sally?
Yes, phase 1B also included public-facing essential workers. And I think Joseph referred to that earlier, that y'all are going to open up to those populations. And I'm wondering when that would be.
Thank you for that question, and we've gotten that a lot. I mean, for us right now, we are focused on the 65 plus. In our catchment area alone, we have 350,000 seniors over the age of 65. What we've been doing is really, and I know people are anxious for the vaccine, but we do refer them. We have a very close partnership with the DOHMH. The Vaccine Finder service that they have is really very good. So our focus right now is on seniors. Things have changed really quickly. So I'm certainly not going to say tomorrow or the next week, things couldn't change. But I do think that most likely for the sort of near-term future, our focus will remain on our seniors.
And one other question, it looks like there's a disconnect between the city and the state. The city has included in essential workers taxi and limousine commission licensed drivers and restaurant workers, and that's not on the state site. So I just wonder if someone could comment on that, whether those are now considered essential workers.
Well, as I understand it, the governor has said that it's up to the localities as to whether or not they want to include those two particular categories, as well as people who serve the developmentally disabled. So the city has to make a decision as to whether or not to open it up to those workers.
So, hi, it's Pauline from the Health Department. Yes, once the governor allowed us to make that determination, we did include TLC drivers and restaurant workers as part of essential workers category in 1B. So as of the 2nd, February 2nd, they are now eligible.
Okay, if they fill out the state forms, though, it's not included right now in the state forms, if they were going to go to a state site rather than a city site. Is that going to be corrected?
We'll have to work with our state partners for them to correct their form, but it should be.
Okay, thanks.
All right, thank you. Betty Lehman?
Yes, I just want to make a comment. On the 26th of January, Isabella and other CBOs were provided a training session to recommend people 65 and older who live in the community. And I just want to say something, because I know we've had a variety of reactions. I have to say the system has been excellent. All of the department heads that I've spoken to were very pleased. And it's only been like 7 days since we started this referral process. And as of today, we've had 135 seniors in the community vaccinated at the Armory, with many more scheduled in the days to come. So I want to commend them, because I know there's a lot of talk about what can be improved, but that is one part of the operation that seems to be going very well. And I thank Ann Sperling, Anna Garcia, and everyone else who worked on that, because that's really quite a good thing.
That's 135 seniors referred specifically by Isabella?
Yes. Mm-hmm.
Yeah, and I apologize, I don't have the number. So I don't want to misspeak, but I believe it's like 8,000 or 9,000 of the patients we vaccinated. I'll get back to you, Steve, on the exact number, have come in through that portal system. There was actually a media story yesterday that talked about the portal and actually talked about how it was a model that other folks in the city could use.
They came in through the portal or through these referrals?
It's the same thing. So essentially we work with community-based organizations and senior centers, give them a training. We can then basically refer people, we schedule them and work with them to get them in.
But they're not using the Connect portal. They have a different means to reach you directly to refer names
correct.
into your system. Is that correct?
That's correct.
Okay. Betty, did you have another?
I just have a question. This is just something minor. It may not be something you can do anything about. One of the comments that I got from one of our community program directors is that the clients are notified of their upcoming scheduled appointment within a day, let's say, which is fine, except some of them need to make arrangements for escort service or even accessor ride, and they've had trouble making those arrangements. They usually need to provide 72 hours notice.
Yeah.
Yeah, I don't know if there's a workaround on that, or if it's just something we're going to have to figure out how to deal with.
Yeah, so that gets back, and thank you, Betty. We've heard that from a lot of folks, and we're trying to problem solve. And I do know there are folks. Can people mute? I'm sorry, it's like feedbacky. Thank you.
Yeah, please.
You know, I've spoken with some folks at the city. And there's potentially some support there in terms of Access-a-Ride. But again, this comes back to the issue of us only wanting to book appointments when we know we have the vaccine. So we're hopeful that in like another week, we're going to have a little bit more foresight. So we'll be able to book 3 or 4 or 5 days out. You know, I think we got a little scared when we saw what happened with Mount Sinai when they had to cancel and reschedule all those appointments. That's not, you know, for now for us, we want to be able to guarantee that the vaccine will be there when we book the appointment.
Okay,
But I'm very, very aware of it. And also we're trying internally to problem solve if there's other ways, whether it's through liver, to just support people.
Okay.
Are you getting the vaccines directly from the city or from the state?
All of the vaccine comes from the state by way of the city.
Oh, all right. But
So Steve, for the queue, we have Barbara, Domingo, myself. Are there any other board members that wish to ask a question before we open it to the public?
Me, Kathy. I can't find my.
Is that Kathy?
Okay.
Kathy?
Sally has his follow-up question.
No, okay.
Okay.
Sal, go ahead and
So
finish.
Barbara.
No, Barbara, you're next. Barbara?
Okay, I have a very straightforward question. It's not clear to me. How many vaccines you have available each day, and how many appointments have you given out each day? In other words, do you have 100% utilization? That's my first question.
So we are, the amount of vaccine we get, and Pauline might be able to here, I don't know. The vaccine we get does change week to week based on our allocation from the city and from the state. We are averaging, on average, about 2,000 vaccinations a day. So that's sort of the average. We do not waste vaccine. You know, we have a very well-oiled machine where at the end of the day, we make sure we're only defrosting enough vaccine so that we are using everything that we have. In terms of the number of appointments a day, it can vary. I will say, just getting back to the question about how much vaccine we're getting this week, and actually I think in part because of the guideline, we've had a very, very busy week. We're always closed on Sunday and Monday, but we had a very busy Friday, Saturday, and then all this week. So it looks like actually we will use up our vaccine and probably not have the Armory open on Saturday because we'll have used it all up. And then we'll reopen on Tuesday when we'll have a new allocation. So we're definitely, we're pushing it out. As much as we're getting it in, we are pushing it out and making sure people get vaccinated. I don't know, Pauline, just in terms of the system of delivery, there was anything else you wanted to add? Or?
Yeah, I mean, no, it's really up to the allocation based on what the state is providing to the city at any given time. And so there isn't a set amount that we're receiving every single week, which makes things a lot more complicated in terms of planning and appointments. But it really is about availability at this point. So.
But have you been, in terms of the portal, have you had like downtime where you've had empty slots?
No, there is, I mean, it's very heartening insofar that when we have slots, people want to get vaccinated. I think, you know, the one thing we're trying to message now too is that we want everyone vaccinated. People do have to be patient. We're going to get in as many people as we can, as quickly as we can. It is also just dependent on our allocation.
Okay, but in other words, you have a full plane. You're not overbooked. You're not underbooked. You're full.
That's how we've tried to manage it. So that we have sort of a steady, constant stream. We got a little bit thrown this week with the weather, but we rolled with it. I mean, the other thing is our teams have done a beautiful job. I think Joe undersold it, but we're also staffing that whole Armory with hospital staff who have other jobs. So we are, you know, we're kind of getting people through and moving them through with teams that have really like made this their number one priority.
Now, you say you're always closed on Sunday and Monday?
Sunday and Mondays.
Okay, good. The blizzard was then. Okay, the other statement I wanted to make.
Other people have questions, Barbara.
Steve. Yeah, Catherine Diaz.
we had Domingo was next.
No, Catherine's a committee member.
Yeah, I threw my question in the chat. Thank you, by the way, Steve. Sorry, let me just find it earlier. But I mean, I think we spoke about earlier around data, and clearly there's a need to have more data. You know, and I completely understand from the start that community orgs were involved. But like, are there actual targets? Are there vaccination goals? Is there a capacity limitation? You know, a lot of our organizations in the community are small, mid-sized organizations, and so they don't necessarily have folks who can be fully devoted to this, is my understanding, for the most part. So I'm just curious, like, are there organizations that were willing to be put up publicly on the news or flyers to demonstrate that people could actually call? Because it seems like, you know, I know from experience, like there are folks who tell me, hey, I go in person trying to get an appointment, but aren't necessarily are redirected to the same website. Right. And so I'm just curious, like, was that a non-starter from the beginning, or were folks, and by folks, I mean, like, were the organizations willing to accept folks that aren't just within their reach, or, you know, the low hanging fruit, as we say?
Hello?
Sorry, I did the classic. I didn't unmute myself. No, I was just saying that there are a lot. We work with great organizations. I know that some of them have certainly, you know, brought others into the fold, but that's why I mentioned before we're getting much closer. I think I have a contract almost with a call center. And of course, the call center is, if we don't have vaccine and we don't have spots and it gets filled up, right, people are going to have to call back. And I again, this comes back to people being patient, but that is a way that people will be able to get to us. We really want people to use the call center who are not able to use the option. We don't everyone calling the call center. But you know, we will target it in terms of our media and how we advertise it. We're going to do a lot of Spanish language advertising. So I'm hopeful that that'll help resolve some of those issues.
Would it make sense to publish a list of the CBOs where maybe people can go? I don't know if the CBOs are even open for business for the most part, but maybe where people would want to just go and talk to somebody face to face to get some help. Yeah. You know, maybe you could publish a list, and we can also circulate that so people know that there's a place right in their own immediate neighborhood where they can just walk in, and that maybe there's somebody there who can help them.
So I don't know who is sort of physically open. We are working on a list. We're just going through to see who would be comfortable, like, having their name out there. I think everyone totally would be. It just, we sort of started this quickly, and unfortunately when we started it, we didn't say to people your name, and we, you know,
right.
I don't ever want to put anyone else's name, but like Cloth, NIMIC, like any of these big CEOs in the community, they're all working with us. Our so many churches, the list is over 50 at this point. But again, I keep pivoting back to the call center, because I'm very hopeful that that will be a way that people don't have to walk into a call center. They can do it. I mean, walk into a building or a CBO, they can go to a call center, especially given.
But again,
then the other issue is around COVID education and making sure people have questions or concerns around it. And that's
that's where I think the face-to-face. Where I think the face-to-face contact would help to reassure people that it's okay to get the vaccine. So maybe you could check with these CBOs to see whether they would be open to having people walk in and they can provide help to them directly. Can I just
make one point on that? Can I make one point on that, though, Steve? The one thing about people walking into CBOs, and we've done so many trainings, is I do think with the vaccines, and as much as I've heard it, you want a clinician, and it doesn't have to be a doctor, but a nurse practitioner, someone who really understands the science, to at least be there. And they can be there with someone who's more of an advocate, who says, you know, listen, I know you're scared. I got the vaccine. We hear a lot like, I don't want to get the vaccine until I see what it does to other people. So, but any group, and I know that in person is different from a Zoom, but we will come, we will present. We will do an in-person.
Yeah, I know, but this isn't the time for group meetings, really. I don't know how effective I mean, I think it's a great offer, but I don't know that it's really gonna be a pan out, because people just aren't doing the group meetings for the most part right now. But
so Steve, yeah.
Just whether we're Zoom or in person, if there's business, we're happy to do it.
Okay,
so Steve, I have a question, but Domingo's hand is up first. So He can go, then I'll go. And then I see Angela, Bernard, and Gary from the public. Were there any other board members after Domingo and myself?
All right, so it's,
No.
what was, who's after Domingo? Angela?
Angela, there's Domingo, me, then Angela, Bernard, and Gary.
Okay, very good. So Domingo, go ahead.
Yeah, as actually one of the few people in this call who's leading an organization that is helping with the vaccination, I want to be real clear. People are not boycotting this vaccination. Uplift, and Uplift is probably one of the smallest organizations. We've gotten over 75 to 100 elders in the past 2 weeks. You know, so it's a matter of access. I think that's what we're seeing. A lot of the individuals that age don't necessarily know how to navigate a computer. It's very difficult. The appointment system, I do have to commend. The appointment system is great. It's very easy. We don't have to deal with the iConnect. Anna and Paula at the at NYP have been very helpful. Where I actually even volunteered to take one of the elders that wanted to get vaccinated, so I could walk through the process as well and see how it is. My only concern walking the entire process is language accessibility. I don't know if it has changed since then, but I took somebody on Friday and I made it seem like I didn't know how to speak, that I was with a family member and I didn't know how to speak the English language. And it was very difficult to navigate that space. At the entry level, we see the vast majority of Spanish speakers. But once you get in and you walk through the process, which is the initial making sure that you verify your appointment, and then you go get your temperature checked, and then they give you a waiver. Then you go, and then after that you actually sit down. I'm assuming that's a navigator. This person puts you in the system, asks for your insurance card and your ID, and then you're later escorted to get vaccinated. And after that, you go to the 15-minute waiting room. I think, I don't know if it has changed, but I think it's really important to have somebody who's bilingual in the entire process, not just a staff member at the holding room. You know,
I totally agree. And you know, we have added more bilingual staff. We are continuing to add more bilingual staff. We did, like, just getting back to the point, and I'm not making excuses for us at all, because from day one, you know, you have to be accessible to the community. But we did stand it up really quickly. And so we have people we've pulled every single bilingual person, like if they work in finance, if they work in human resources, they're there. And we're trying to pull in more and more every day. So totally appreciate it. You know,
and the process is smooth. I can't speak on the process.
Yeah.
The registration is smooth, but as somebody who runs a small nonprofit, all I would say is think about the small nonprofits, because we're actually doing this because we want to help our community. But the calls are nonstop. You know, because now once the new mandates were put out, you have a bunch of cab drivers and a bunch of different people who essential workers now who qualify, calling nonstop. But unfortunately, the hospital has dictated that it's only for folks 65 and older. So I think once it opens up, but I really do say consider the small nonprofits and just make sure that we are, like, at least we're trying to do what we can, but it would make sense for us not to have to worry about follow-up calls if they could just be a text message sent after we do the appointment.
Thank you.
Domingo, are you saying that you were able to get 75 to 100 seniors vaccinated?
As far as there's no follow-up for us that lets us know if the people that we provided appointments for actually got vaccinated, but they do send you Paula sends you a verification list that just lets you know the appointments, and then you're supposed to follow up with the individuals that you registered. But that becomes a little burden because it's we're already volunteering to register folks, and now we have to do the follow-up as well.
Yeah, well,
and that's why we are setting up a hotline, because, you know, I totally feel your pain, because we're also staffed by volunteers. So I think we're all, like, for these first couple of weeks, all just trying to work together and do whatever we can to do the follow-up, but hopefully that will help resolve some of these issues when there's a.
Yeah, but Anna and Paula, super responsive. You can hit them up at any time, so I can't complain on that end.
Okay.
So as far as you know, you got 75 to 100 seniors appointments, and presumably they went through the process and got vaccinated. Is that correct?
The hospital should have that data.
Okay, very good. All right, thank you, Domingo. Darryl, you're up.
Yeah, hi. I had a few questions. In terms of the people that don't live in the neighborhood, are you referring them somewhere else when they come to you, or what are you doing with them?
So for folks over 65 who live in the 5 boroughs, we refer them to the New York City resource, the VaxFinder, and that's sort of been the process so far. We've not had a lot of people just walk in from outside of, I would say.
Okay. And I had a couple other questions. You said you're not open on Mondays, but will you be open on President's Day? A lot of people have off that day.
I can't say for sure, because that feels like a lifetime away right now. But I think typically our goal is
10 days, I think, but yeah.
Yeah, our goal is to stay closed Sunday and Monday. I will also say, just in all of our conversations, because we are working with seniors, the hours have been okay for people, because a lot of folks are retired. So and we do have people can come in at lunch, they come in after work, open very early. So
What are the hours? Like 7 a.m. to 9 p.m.?
Well, they sort of vary, which is why we haven't posted them, and some of that is based on vaccine. But we usually start appointments around 7 a.m.
And it usually goes until 9?
I mean, we're trying to stop it a little, like 8, 7:30. It slows down by then anyhow. I mean, most folks it begins to trail off, but around 7 to 8 p.m. hour.
7:30, 8 o'clock. What was it?
Something like that. It hasn't totally been consistent, because sometimes it's based on vaccine, it's based on how many people are coming in. People have scheduled appointments, but they might cluster. So.
Okay. Angela, is that Angela?
I'm not, Steve, I'm not done yet. A couple more questions.
Okay.
One's quick. With the language access, have you seen a lot of need for Japanese, or is that fairly taken care of? That is the third most spoken language in the neighborhood, apparently. So
I don't
agree with that, Darryl. I got one person, I got one person. So that's an interesting fact.
All right.
Yeah, I mean, I know the Parks Department tracks that, and Japanese is third on the list after English and Spanish.
All right.
Okay. If it's not an issue, it's not an issue. But I was just
we
wondering.
haven't had any. Yeah.
Okay. I would say, Steve, it's
Russian would
okay.
be the third language.
What's that?
I think Russian would be the third language, not Japanese.
I think you should check your department's own statistics on that. But,
okay, fine.
But lastly, I know we had talked over email about the surplus vaccine issue, and it doesn't seem from what you're saying that it's really much of an issue. So can you talk a little bit about that? I know Barbara touched on it a little bit. How it is, how many a day are you having surplus, and what you're doing with those, et cetera?
So I'll be honest, I'm completely out of my depth here, because this is not my, I'm not the person defrosting the vaccine, but I do know that when I have talked with the operational folks, they've said that after like the first day, when they just had to sort of adjust to make sure that we got everything filled, we do not have surplus, because they basically time it and they schedule the appointment so they know that we all have exactly enough.
Do you have any idea how long it takes to defrost the vaccine?
Again, I'm sorry. This is like,
okay,
you can ask
forget it.
any government and community affairs question you want, Steve.
Okay, fine. Forget it. Okay, fine.
And I would just say, going back to Steve's much earlier comment, if we have it at Coogan's, Steve will be flipping burgers.
Yes,
okay.
I never had, hardly ever had burgers.
They haven't reopened bars yet.
Or wings.
Okay, can I now call?
Talk to us about that.
So now we can go to the public, I believe. Oh wait, did Maria want to chime in?
I want to call on Angela.
Oh, okay, Steve.
Thank you
Maria's
so much.
hands up too.
I really appreciate this, and I really appreciate hearing directly from the hospital. So I have a couple of questions and actually a couple of things I would love to share. Number one, I know you mentioned earlier the systemic advantages, and I just wanted to share with you that I think that the hospital is in such a unique position to actually address those systemic disadvantages just from your own, from the position of your own institution. The reason things become systemic is because it's large institutions, large government entities that are approaching things in a particular way. And so the reason I'm framing this way is because early on, I had heard directly from frontline workers, employees, including doctors, healthcare navigators, that said to certain administrators, and I don't know who they would be, that the way that the system was set up with the eConnect, that it was going to lock out and it was going to be discriminatory towards a particular sector of the population. And now we know that there was that happened. And I hear you on the CBOs. I mean, I was the executive director for 10 years of the Northern Manhattan Coalition for Immigrant Rights. And absolutely, like when we're asked to pitch in and help, I know that everyone does it, full force and full on. I can appreciate like creating a new portal just directly for that to really simplify. So I definitely congratulate you on that. But it still doesn't address, and I'm very happy to hear that you guys are going to create a hotline. So I just wanted to know, when do you think the hotline will be ready so that people can just call to make an appointment?
Yeah, so I'm very hopeful that we will, and they're hiring, so we've got to hire up, but that the week of February 15th at some point, we will be able to launch it.
Okay, great.
The week after next. That's my goal. I mean, but from day one, I will tell you, Angela, I appreciate everything you're saying. Things move really fast when you're setting up a mega site, and there have been a group of us that are like, we think we probably need a hotline, but at the same time, right, we're all sort of learning as we go. So
I definitely appreciate that, because I ran a huge agency, the Division of Human Rights, at the state level, and I know how difficult it is to get something operationalized. But this is where I see the opportunity, where if you were to build internal structures where you're automatically having direct conversations with your frontline employees on a regular basis, so that then it's very easy to move quickly when another situation like this comes up, and then you already have those direct conversations with folks that will say to you, you know what, if this is coming down the pipe, let's start thinking about opening up an appointment hub, a walk-up appointment hub on 181st and St. Nick's and Dykeman, things like that. And I think that can only come when you already have internally an institutionalized way of addressing the systemic issues that we have in our larger society. And then the final thing I just wanted to share was that I definitely got a lot of calls from people that didn't know about CBOs, couldn't do the eConnect. They were the children of the elderly, and I did connect them to the CBO. So I'm glad that we had that option. But there's still a large group of people that don't know about these CBOs at all. And so that hotline will be great. And then the final thing is for the CBOs. So knowing, what it's like to want to take on something as important as this, would the hospital consider providing economic resources that can allow a CBO to hire someone part-time? It wouldn't necessarily be that expensive, but someone that could work part-time from the CBO. But they're the ones only in charge of doing all those calls.
So, that's sort of the model of what we're looking at here with this hotline, because the hotline will be run by a CBO. So the CBO will hire from the community. And then if we need to staff up more, they will hire additional people from the community. So it will be CBO run.
Got it.
So
Okay.
that's essentially the essence of what we're planning. This is not, I think everyone acknowledges that it's important to have, an organization that is trusted and is known to the community. I like to think that NYP is great, but so that's the sort of goal model with this. And I'm sure, by the way, we'll roll it out, and there's going to be need for tweaks, and it's not going to be perfect, and people are going to call. We may not have appointments. Just ask everyone to be really patient, but that approach is the one we're moving towards.
Great.
And put it, Angela mentions using hubs spread out in the community. Why can't we use the ambulatory care network sites, which are, you have 4 or 5 of them spread out from 135th Street up to past Dyckman Street? Why can't we use those sites as places where people can walk in to get appointments?
I don't think there's a need to do that, Steve. And honestly, because of COVID, where we want to minimize the amount of physical traffic, and especially if we're talking about seniors going into a healthcare facility, the easiest thing, which we're going to try, and listen, by the way, we're going to see how this works. And then if we have to explore other things, and whether that's canvassing or different types of approaches, but to enable people to just pick up a phone and call seems to me like the lowest risk way in a pandemic, right? Where we don't have to get people to get out of their houses and put themselves at risk unnecessarily.
All right.
Thank you so much.
Thank you, Angela. Bernard, you're up next.
Okay. Yeah, I wanted to. I had to go to the South Bronx in order to get my vaccination. When I initially tried to get vaccinated, there were no sites at all in Washington Heights, and then the Armory was just opening up, I believe. And I went in to connect, and I signed up, and it was very convoluted signing up. And then I went in, and there was nothing but no appointments on any day that I clicked on for the Armory. Every day that I clicked on for the Armory. I'm 68 years old, so I was trying to get in as soon as the 65. As soon as over 65 was started, and literally there was it's like it's a black hole here in my neighborhood over here in Washington Heights. I'm in kind of like the lower heights. There are no places to get a test, and there's no place to get a vaccination, literally, except to go up to the Armory. But anyway, so I went through all of the different sites, and I tried and I tried and I tried, and I finally got to South Bronx. I had to take an Uber over there. So, but, luckily I can afford it, so I got $40 to get my free vaccination, and I'm going to go back. I have my appointment to get the second dose. But I just wanted to point out, this is not, I'm very computer literate. I'm on a computer all day long, generally. So it's not easy. It's not easy. I can't even imagine what it's like for a senior who's not really, doesn't know computers very well. Because I was having to go in order to get my appointment, even in the South Bronx. I had to go in, I believe it was Vaccine Finder or something like that, whatever the website is. I had to go in there and keep on, every time I came out, because I would find that there were no appointments available, I have to pull out and go back in and reapply, literally reapply every single time. It did not take my information to keep it. Every time I'd have to put in my health insurance information every single time. So I just wanted to point that out. I mean, I know it's a really hard job right now, but I'm one individual who's not afraid of the vaccine. I wanted it really badly, and it was very hard for me to get it. That's it.
Yeah, I can just jump in here, Mr. Grubman, because I think a lot of your concerns were more about the city-run Vaccine Finder site as opposed to what New York Presbyterian's doing at the Armory. So absolutely 100% agree with how frustrating and cumbersome the website is. And it's just due to the nature of technology that we can't integrate every single vaccination site's registration page to hold on to people's information. And we've definitely heard that has been an extreme point of frustration for folks, and we really wish that we could have better technology to make that happen, but it just goes back again to a lot of the questions and the concerns around just access and healthcare access and things, health disparities that the city health department has been working on to try and alleviate even before COVID. But you're absolutely right that it's in your district in particular, there are very few vaccine locations. So I just wanted to validate everything you were saying and to let everyone know. I don't mean to take up Anne's time, but I just really want to let everyone know that, there's a lot of considerations when it comes to opening up a particular site for vaccines, just due to the nature of the vaccine itself. It requires extremely cold, freezing temperatures. And so equipment is important, and just the infrastructure that currently exists, it's just pretty difficult for us to find locations in Washington Heights and Inwood, but we're hoping with the federal government allowing, pharmacies more access and just more access to vaccines in general, that will sort of help alleviate some of these issues. So I just wanted to put that out there.
Well, the site that I went to in the South Bronx was a high school.
Yeah, but it's part of so the city has worked during non-emergency times to build up these what we call pods or hubs of sites where we can do mass distribution. And so there are some equipment that's available through our system already to be able to stand up sites in schools or in existing city infrastructure. So yes, you're absolutely right. We have sites available in high schools. We can work with other locations like you've probably heard Citi Field and Yankee Stadium. But I'm talking about like really community based, like in a community senior center, things like that, where it's a little bit more difficult, but totally get your point. And I think up to now it's about supply as well. So we have a ton of hubs that are ready with volunteers from all city agencies ready to stand these sites up. It's just we're still waiting for the supply.
Okay. All right.
Thank you, Pauline. I do want to, Bernard, I do want to point out that there are two locations within the immediate community where both of us live for testing. You can get tested at the Health Department Center at 168th and Broadway, and up at the Highbridge Recreation Center at Amsterdam and 173rd Street. That site is operated by Health and Hospitals. So there are two places nearby where you can get tested.
Do you have to call for an appointment at those spots?
No, you have to. For the one at 168th Street, you can get an appointment through the website, and at the Highbridge, you can just walk in.
Okay, thanks.
But be prepared for long lines. Doctor,
we have Gary and then Maria.
Dr. Aldheim. Is Dr. Aldheim still with us? All right, Maria Luna.
Hi. Hi, everybody. I just came home from the Armory. I just had my second shot. So I am really excited. And also, hey, Steve, you didn't say thank you, Maria Luna, for getting you in without going through this whole registration and all these things. So do I hear anything good from you to me? Otherwise, you'll be on
Thank you, Maria.
Okay,
I thought I had to thank Alana Donner for getting me through the senior center.
Yeah, where she got information from?
Also, Maria's the plug to get the vaccine.
Let me just tell all of you that I'm very happy to be working with Alana and also with Firm. My sister and I have registered over 250 people from this community, regardless of color, religion, and I am fed up because this afternoon, while I was waiting for my shot to be, given, a woman from this community called and she said, "Are you taking care of white people? Because I am white and I see that there is a discrimination. Well, my next door neighbor is white. I want her to get her shot because she has to have the same opportunity that everyone else have here. And I am insulted as a Latina that people are using this thing to discriminate against other people." Now, the operation that I have seen at the Armory, I've been there twice, because you know that I like to put my nose all over the place. It's fantastic. The people who are taking in without even a registration, they say, "I've been waiting to get my vaccination, but I haven't been able to get in the computer system to get me the access to an appointment." So she was there. The people were very helpful. They said, "Stay here. We'll see what we can do." And a few minutes later, we saw them in line, ready to be taken care of. So that's admirable what is happening at the Armory and also by New York Presbyterian Hospital. So everybody that is knocking down everybody because of race and religion, you better get your eye together, because everybody that I saw online means, all colors, all faces. So let's give credit where the credit is due. We are registering. As a matter of fact, if you see this, I walk around on Broadway when I have to go to Broadway with my pad, and I ask everybody that I feel that is over 60. Some people said I'm not 50 yet. Oh, Sally Fisher. Is Sally Fisher here? I tried to get Sally Fisher, but she's too young. She have a long time to get, over to 65. And
All right.
people from the community. Steve, stop it, okay? Okay,
All right.
because
All
I'm
right,
doing
thank
a
you.
lot of work in this community to make sure that everybody, Black, white, Latino, is registered, and I supply this information, and 2 days later, everybody is being taken care of. So this nonsense that some people are using against the hospital, the Armory, has to stop. Everybody's getting a chance, and I tell you, because I have seen that firsthand. So stop the nonsense, and try to get, and walk around like I do in this community with a pad registered. I had 3 people that already
Sounds
have,
like
I
Maria
have
Luna's
named
a
to be
lobbyist.
registered.
Bravo,
Maria,
bravo, Maria.
Yeah,
Thanks, Maria.
Maria, you're doing great work, but this whole system cannot rely upon people just walking around with pads. We need something better than that, which hopefully the hospital is now going to be setting up.
We had another question from the public, Cheryl.
Yeah, go ahead, Cheryl.
Hi, good evening. You can unmute me, but not everybody in this community have access to internet or to any type of connection. Okay, thank you so much.
That's the exact point. That's the exact point we're making here, Maria.
Okay.
Cheryl.
I speak. Thank you very much. Okay. So, okay, I just had a quick question. I was there on the 21st to get my first shot. And I know that the Armory is only supposed to be doing 65 and over. But as I was sitting in the observation area, I saw, a lot of people to me that didn't even look 65. That was an observation I made. So is there a reason why some people that were there looked younger than 65?
Yeah, so we do have a handful of folks on our own teams who, we had been doing sort of in-house staff vaccinations, but just to make it more efficient at Columbia for people who needed doses, we moved that into the Armory. So we were doing it all together with the refrigeration and everything. So that's who you saw. It was NYP employees getting their dose.
Okay, thank you.
All right, Daryl, is that it?
Yeah, unless there's any last minute ones, that was it. Thank you. It is 8:07.
Yeah, I know. Okay, so Ann, I got my 2 final questions. Number 1, do you have the statistics that we've been requesting about the numbers of COVID patients that have been treated, admitted, discharged from the 3 Washington Heights Inwood facilities?
I don't. I have the sort of system-wide breakdown. I think, and I know we've talked about this before, Steve, and just to sort of share those numbers. So right now across our system, so we've got a hospital in Queens, Brooklyn, our uptown hospitals, as well as Cornell, and then 2 small hospitals in Westchester, as well as a very small hospital in Lower Manhattan. So as of today, we're at about 970 patients in-house. So, it's not an insignificant amount. We were down to about 85 in October. We were as high as 2,500 during the thick of it in April. We are seeing a lot less severe disease. So we have about 160 of those 967 thereabout patients are in the ICU. I will say that we have a decent amount of patients at Queens. That's where we are seeing some challenges at Queens. The reason why sort of the site-specific data is not sort of compelling is it does not tell an accurate story of the impact on the neighborhood, because we're a hospital. We do take patients from all over. So I would definitely direct you to whether it's Pauline or someone at the State Health Department. I don't know, Pauline, if there's anything you want to say sort of about the demographic zip code data that the health department collects, which is really the indicator for the impact of COVID.
All right, and my point is, I mean, we do we do collect the information from DOH, which I'm going to report on shortly for our 4 zip codes. But again, as I've said repeatedly, we are particularly interested in knowing the impact on the 3 facilities within our community and how they have been impacted by COVID. We have a particular interest in what's happening within our community, regardless of whether or not the people being treated are local residents or not, as much as we would also like to know the numbers of local residents that are being treated in those 3 facilities. And I really cannot understand why it's a problem for you to provide this information. You obviously have it available, and I don't, I think in the interest of transparency, it would be to the hospital's benefit to be able to show us the extent to which you've been impacted and you've had to adjust your services to handle COVID-19 patients at the Allen Hospital, at Milstein, and at the Children's Hospital. And I urge you once again to let us have this information.
Is there another question?
I just wanted to say very quickly, because I know time, and thank you, Daryl, and I'm not going to keep up time because I know. I just wanted to say I do appreciate the work that you're doing at the armory in terms of getting, correcting the problem, quickly correcting, this problem, and making sure that it is more equitable. But I also just don't want to minimize, like, we do need race data. We do need to make sure race and ethnicity data. I don't want to minimize that and make it as if it's not important. It may be, yes, that you are serving people who are very diverse there now, but it is important to understand, to break that down and make sure that we are capturing all the different communities and that we are addressing their specific issues. I don't want to have to minimize the fears that have come from certain communities because of their mistreatment by the medical community. And this is Black History Month, and I want to say, as part of that, Black people, slaves, were experimented on, including in gynecology, illegal and unethical experiments and things like that have played into a lot of these fears. So I don't want to go into this minimizing those things and making it as if it's not important or we shouldn't talk about it. And I think it's very dismissive if we have that attitude, from the Tuskegee experiments to illegal fertilizations to illegal experiments on slaves that started medicine in this country. I really, without anesthesia, by the way, I really would like to just not have that attitude. So I just wanted to put that out there, that it is important, and I expect that to be honored, and that we do respect those different communities and do what we need to do to reach them, and to find out if we make sure that we are constantly monitoring if we're reaching them, and to reach them properly. Thank you.
All right, Ann, and my last question is with respect to the Allen Hospital. Is there any update on the status of the psych unit?
There's not. I mean, honestly, we are continuing to use all of our, a lot of our spaces for COVID. So bear with us a little bit. We've been, very focused on the second surge, focused on this vaccination effort. We remain completely committed to behavioral health. I do not say that in any way tongue in cheek. But we do not, because of sort of how the last 5 months have rolled out for us, don't have an update on that yet. I promise you.
I'm sorry, what was the last sentence?
I said, I promise you will be the first to know.
Yeah, well, I'm not sure about that. But can't the hospital at least make a commitment that once the COVID-19 situation is under control, that you'll be able to return the psych unit?
We can't do that right now, Steve. I mean, we are sort of working moment to moment to address COVID, to address vaccination. That remains sort of our focus. At the same time, we are taking care of all of our behavioral health patients, inpatient and outpatient. We recognize more than anyone, I think, based on what we've been through over the past 11 months, the need for behavioral health care, both inpatient and outpatient. So it is absolutely something that we are completely committed to. I can't give you any sort of a kind of promise or commitment right now about what could happen in I mean, we don't know. Well, we could still be vaccinating the community. There's so many sort of things at play. So
No,
I'm
I'm
hoping
not,
that means that we've moved on in a certain sense.
no, I'm not asking for a date certain. I'm just asking that, that you restore, under what I believe is your, legal obligation, the service that's, that you're licensed to provide at the Allen Hospital.
Got it.
Okay, all right, thank you, Ann, thank you for giving us so much time, and we'll be happy to hear updates as time goes on, and as you're able to implement the hotline and the other efforts in community outreach. And again, it would be helpful to have the regular reports on the zip code and racial breakdown of people who are getting vaccinated. All right.
All right. Thank you, everyone. I really appreciate it.
All right. Thank you. All right. So if I could just do the latest reports from the health department in terms of our positivity rate. The positivity rate in zip code 34 had went up for the week ending February the 1st, Monday. It's up at 9.38%, 121 positive cases. The positivity rates in the other three zip codes have gone down. In zip code 40, 8.76%, 120 cases. Zip code 33, 6.79%, 121 cases. Zip code 32, 6.61%, 149 cases. So in the week ending Monday, February the 1st, 511 positive cases in our 4 zip codes. The cumulative total of deaths in our 4 zip codes, 541. And the cumulative total of cases, 12,900 in all 4 of the zip codes. Pauline, are you still with us?
I am still here.
Very good. Do you have a report?
Sure. So I wanted to just
can we get Mini Me back? Where's your Mini Me?
Who's Mini? Oh no, I sent him away.
Oh, he's cute.
He may not participate. He's too distracting. So what was I going to say? Oh, so I wanted to touch base with Barbara first because she had that question about TLC and restaurant workers and their eligibility. You're right, the state's website does not account for them just yet, but they are eligible for all city-run sites. So at DOH, MH, or H&H facilities, they are able to sign up. You know, all they have to do is show their employee ID, and they're set to go to get their vaccination. So as long as they're able to get an appointment at a city-run site, they're totally fine. And we are telling the state that they need to update their website. The state also, unfortunately, like doesn't understand that a lot of folks like just cannot use the internet or don't have internet access, and they've made a lot of things pretty complicated. So we're trying to work through that as well with them. But yeah, I mean, just going back to a lot of the access issues, you know, we are trying to revamp our website to make it easier for folks. But again, we do have our call line, and I get that some people have had some frustration with the call line, knowing that they'll call and then there aren't any available appointments. So again, hopefully with the federal government streamlining the supply chain and really amping up the supply production, hopefully New York City will continue to get more vaccine doses allocated to us. Again, also mentioning that the federal government is working on a pharmacy plan where they're going to be allocating a lot of doses to pharmacies in local jurisdictions. So hopefully more pharmacies in New York City, particularly in your district, will start getting their doses online to be able to vaccinate the community as well. Also, we've had lots of conversations between the Vaccine Command Center and local community leaders and community groups about potential vaccination locations in the community. considering the storage questions and all of the other issues, we still want to be able to identify locations should vaccines come online that don't require all of these specialized equipment, to be able to utilize local community centers as hubs for distribution. So those conversations are ongoing. And we really want to continue uplifting the voices of community members who have received their vaccinations. I think, touching on Tanya's point, it is so critical that people from the community hear from members of their own community, right? It's one thing for government to say over and over, these are the recommendations, these are the guidelines. People are tired of hearing from us. People don't trust us. People are not interested in the things we have to say. And so a lot of the legwork we have to do as a city agency and as a public health agency is really uplifting local community voices. And so we really are interested in identifying people who want to be able to assist in that. So if you know anyone who wants to have town halls or wants to have these info sessions where we can really talk to people in a safe way, in a culturally competent manner, to really address their real concerns around vaccinations and to ask questions that they might not normally feel comfortable asking, we are so willing and ready to do that. So please reach out to me to schedule any type of speaker engagement. You know, we have a lot of MDs on our staff that are willing to do this, but we also have a group of people who, you know, work in the health department who have been trained on a lot of the speaking about the vaccine, and to be able to share this information. And also, I think a peer dialogue is really helpful as well. And so, you know, we can really speak from experience in terms of folks who have been vaccinated, and again, really depending on the community to partner with us to highlight the vaccine itself, and to really get accurate information out into the community. So really wanted to just highlight those things. And then if you have any questions, I'm here to answer them.
Yeah, well, Pauline, is the hospital allowed to decide on its own eligibility criteria? Can they, if the city facilities are accepting the taxi drivers and restaurant workers, is it acceptable that the hospital is saying that at this point they're only taking seniors?
So I don't know 100% whether or not, I mean, I think they said they set aside a certain amount for the community and allowed it to be for people 65 and older. So I'm assuming the other allotment is for the general public where they're eligible. So again, keeping in mind eligibility. But I think that the Armory, and I don't want to speak for an NY Presbyterian, but I think they did want to make sure that the vaccines were available to local community members, even though, as Anne mentioned, you know, some folks sort of get around the system in many, many ways. Like if you have a really high-speed internet and your computer is really fast, like some people just have better and quicker access to appointments, which is really unfortunate. So I think it's sort of their way to make sure that the community has the ability to access the vaccine, also considering, you know, a little bit of failure on the city's part to be able to have vaccine sites in the district. So I think, you know, I think we don't want to discriminate against anyone. The vaccine should be available to every eligible group. You know, that is determined by the state, but I think I can understand where NYP is coming from.
I understand it too, and I understand that you know, there's a rationale to wanting to try to reach as many of the seniors as possible, but it's a confusing message to the public. Sure. When you hear on the radio that taxi drivers, restaurant workers, developmentally disabled workers, staff are now eligible, and then this particular place doesn't accept them, and you know, you would expect the eligibility criteria to be the same across the board. You know, it's just confusing.
Sure. You know, I think as a private hospital, I think they're allowed maybe to make these determinations. I'm not 100% sure, so I can't speak to that. Okay. But, you know, the city sites, and as long as we get shipment in and there is vaccine available, we want to vaccinate every single person that is eligible to be vaccinated. So that is the goal and that is the plan. So.
I mean, we certainly have a lot of taxi drivers and restaurant workers in our community, and it is, as you mentioned before, a problem that we don't have a city-run vaccination facility within our community.
Yeah.
Are there?
I also wanted, Padmore had to leave, but he wanted to share the transportation options for folks. So if you are unable to get to a vaccine site, you know, in a way that is convenient for you, and you need assistance with transportation, the city does offer transportation to city-run sites. So either a DOH-MH hub or an H&H facility. All you have to do is, when you're calling to make your appointment, request some transportation, and someone will be able, you know, transportation will pick you up from your home, bring you to the vaccination hub, and then you will be able to be picked up from the vaccination hub and brought back home. So I just wanted to throw that out there as well, free of charge.
Okay, very good. I don't think that was generally well known.
Yes.
Richard, before I get to you, are there any committee members who have questions? Daryl, do you see anyone?
No, just Richard.
Okay, Richard, go ahead.
Oh, you're on mute, Richard.
Yeah. No, I think it's still muted.
Not anymore.
Yeah, go ahead.
Just question on the list of eligibles. Where are things moving in terms of home health aides and people with high-risk medical conditions who are under 65? And
So,
just a comment from observation. There aren't a lot of places in this world where seniors get any priority. It's not a terrible thing that's happening.
Sure. So home health aides are actually eligible. They have been eligible under 1A, I believe, as you know, frontline healthcare workers. So yes, if someone is a home care aide, they are able to receive their vaccination because they are working with a very vulnerable population. In terms of underlying health conditions, we're still waiting for the state to really define those. So for people under 65. So we're still waiting patiently for those guidelines to come down. And once those come down, we will update our website. Oh, and speaking about our website, going back to Tanya's point, we've broken down the vaccination rates by ethnicity and race. And so we do see that a vast majority of white New Yorkers in both age ranges from 18 to 64 and 65 plus have received a majority or have a majority vaccination rate of the total doses administered in New York. So I think that's an interesting new data portal for Steve to look over and then tell me how terrible our data is. But so that's up on our website. And so if anyone's interested to see that, it really does drive home the point, though, that we do need to do much better work around communities of color, particularly Black and Hispanic and Asian folks, actually. So the Asian population in the 65 and older are similar rates to the Black New Yorkers at about 11%, which is pretty low. So we really need to do a much better job in outreaching. I think a lot of this is just my own personal speculation. I think a lot of it has to do with the way that people sign up. So we do know that that is an extremely cumbersome process to try and get an appointment online. And so, you know, we did hope that the vaccine call center, that call line, would help mitigate some of those access concerns. But, you know, we are trying to do a much better job in reaching folks who, you know, maybe just don't have the internet access or don't have access to a computer, or just, you know, don't, like my parents are not tech savvy at all. So, you know, we really need to do a better job getting them access to their vaccines.
Pauline, I had a couple questions.
Sure.
Just following up from last month's meeting, you were going to check on whether or not there was someone at the state level that could provide us the hospital level data. Were you able to find someone who has that information at the state level?
I was not, unfortunately. I've been trying. I've been asking every single person that I know within the health department that is in this structure, and everything we have on hospitalization data is on our website. So everything that we have to offer is on our website. So I think I believe we have hospitalization rates by borough, and that is about the information that we have. So anything that the health department has access to, we've put it onto the internet.
Okay. And also, we had talked about maybe having mobile units that could go out with the vaccine to particularly hard hit areas. Was there any progress made on that front?
Yeah, so again, it's all with the storage issue and the supply issue. So, you know, it's really about how the vaccine doesn't travel well. Maybe if these mobile units are very cold or have the equipment to store things at a very cold temperature. But again, it's just, I don't know if such thing exists. And it's also, you know, we're trying to build on existing infrastructure, existing equipment that we have. And so, you know, it's really difficult to say whether or not we have the ability to purchase really fancy mobile units that can hold things at really cold temperatures. And then also, you know, just the nature of the vaccine and the supply. We're really just hoping that the supply increases. And again, hopefully with new vaccine that's coming online, hopefully they get approved. You know, there's a lot of promising talk about the Johnson & Johnson vaccine. That's only one dose. It doesn't require a lot of the same refrigeration storage capacity issues. And so maybe that, you know, when that becomes available, it can be utilized in a way that we can really get the vaccine to people as opposed to the other way around now where we're trying to get people to the vaccine.
Okay, great. And just a point of clarification, the public facing essential workers have been eligible since the 65 and older. The only addition, Steve, was the taxi and limousine guys and the restaurant workers. Those were added this week. But otherwise, the 65 and older and essential, that's been effective since January.
Yeah, I know, but they also, there was one other category that was just added, people who were taking care of the developmentally disabled.
Yeah, and that's not even on the city site yet.
Yeah, but that was one of the categories the governor said would now be eligible.
Yeah, I think we're probably working through the logistics of that. And once that is confirmed and clear, we'll put it onto our website as well. So again, encourage everyone to go onto our website to make sure that they have all the updated information. So as long as it's clear and confirmed information, we put it onto our website.
Great, thank you.
Who did you say is reaching out to the pharmacies? Who's lining up pharmacies?
Yeah, so I think the federal program is, I think pharmacies are working through, you know, the feds to be able to sign up and participate. But like Anne mentioned, right, like the federal government allocates each state a certain amount of vaccine, and then it's up to the city to distribute. So I believe that the city will be in charge of distributing to all local facilities, whether city run or private, including pharmacies. So I'm not 100% sure how that's all going to look, but I can definitely circle back with the Vaccine Command Center to see if they have more details on that.
All right, thank you. Any other questions or comments for Pauline? Oh, very good. All right, thank you again, Pauline. Hopefully you'll be back with us. I think it's March the 4th.
Sounds great. We'll be here.
All right, thank you so much.
All right, have a good night.
All right, so we lost Padmore. Janelle, are you still with us? Janelle Edwards?
I'm here. Sorry, I was on mute. How are you, Steve?
You should unmute yourself. We don't want you to be muted.
Oh, thank you. That's very kind. I don't really have a report this evening. I'm sure you got a lot of extensive information from the hospital, and they were best prepared to answer your questions and not, the medical center per se. But we're just letting you know that we are in the midst of planning an upcoming community research forum, and we will be in touch once we lock in the date about what the topic will be and how we can continue to partner with the Health and Environment Committee to make it a success.
All right. Well, we appreciate that, and we'll do what we can to help publicize it.
Thank you so much. If anyone has any questions, you can feel free to reach out or ask Steve, and I'll follow up later.
Okay, let Ross know. I assume you will. Let Ross know that we did have this thorough discussion tonight about the vaccination site at the Armory.
I definitely will.
All right, very good. Okay, Betty, Isabella.
Yes, hi. I apologize, my computer completely crashed this evening, so I'm working off a phone and a call it a tablet, I guess. All right, about Isabella, we have had, starting December 23rd, we've had a series of clinics where we've been distributing the vaccine to our residents as well as our staff. As of today, 80% of our residents have been vaccinated. Hello, can you hear me?
Yes.
Okay, and 45% of our staff have been vaccinated. I just, so as a point of reference, I happen to be working from home on Monday, and CNN had a report about nursing home residents nationwide and staff, and they said that nationwide 77% of nursing home residents had been vaccinated and 37.5% of nursing home staff. So we're ahead of the game in terms of the national averages. We continue to work with the residents and their families, providing them with education. We have them have consults with the social workers and the doctor if they need to get information for their relative or for themselves regarding the vaccine and any adverse impacts that it may have. We have one more clinic session coming up on Saturday. That will make it a total of 6 so far. We are, as you know, working with New York Presbyterian on the community residents that are part of our community-based programs. And we hope to continue to work with CVS as well as with the community, especially, I guess, in the future, New York Presbyterian, to continue. As you know, with the nursing home, there are admissions and discharges. So that number of 80% will fluctuate depending on, new people coming in and people leaving. But we're attempting to keep it consistent and keep it going. In any event, what else can I tell you?
Are you going to be able to get enough vaccines to vaccinate 100% of the residents and the rest of the staff?
We have the CVS has been working with us. They're the ones that have been providing it because it's between Walgreens and CVS nationwide, and we have a contract with CVS. And there's been enough. But the challenge, as you know, is that nobody is required to take the vaccine. It's not like it's a law. So we have residents and their families that are either reluctant to take it or want to wait and see type of thing. A lot of it is concern. They want to make sure it's fine. It's a little too soon. You have a lot of that hesitancy. The same thing with the staff.
Really? You think the staff would be less reluctant? I mean,
yeah. Well, they're coming along. It's really coming along more as time goes on. It's only been about a month, basically, or a little bit more than a month. So some of the staff wanted to see how is it affecting everyone else, and that's part of it. So more and more staff are coming forward all the time. In any event, on another note, we had Mariano Rivera and Dr. Talaj come to Isabella in December, and they conducted video chats with various residents of the nursing home and provided gifts for grandparents. So that was a big deal in terms of our, positive impact with the residents. And we also recently, as of a couple of weeks ago, got connected to the Hebrew Tabernacle, and they did with us a mitzvah day where they wrote cards and so forth to the residents of the nursing home. We thought that was very nice of them to do that, and we're very grateful for that. We, of course, maintain our window visits for family members. And, it's a little challenging sometimes with the cold weather, but we've been able to maintain it, at least at this point. So we're working, and we, of course, we work very closely with all the agencies, federal and state, to make sure that we're in compliance with everything. So we're on a good note at this point.
Even Mariano Rivera had to stand outside the building, right?
Yes, he did. Yeah. Yes. Yeah, it was like a video visit for a family member, right?
Right.
Yeah. Anyway, so that's the report.
All right. Very good. Any questions for Betty? I think what I noticed, Betty, in the latest State Health Department report on nursing home deaths is that I believe Isabella has the same number that it's had for a period of time, but it looks as though they moved one of the presumed deaths to being a confirmed COVID-related deaths, so that you still have a total of 68.
Yes, we've had a couple of residents that have come in or had COVID, but we've obviously they're separated, and they've been treated and they have recovered. So we haven't had any deaths at all.
Right, for a while now.
Yeah.
But you've had a couple of patients who have come in with COVID and
No,
recovered.
well, they came in. Everyone who comes in is quarantined. Everyone, no matter who you are, quarantine in a room by yourself for a minimum of 14 days, because we can't be sure what the situation is. And then once we determine that you're okay, then you can be moved into a general population, if you will. But there have been a few people that have come in that we've discovered when they came in, maybe not the day one, but a few days later, that they in fact were testing positive for COVID, because we do test everyone. And
So these are new residents.
yeah, yeah, yep. So we just want to make sure that they get the care they need and that they recover.
Right. All right. Very good. All right. Thank you.
Okay.
Is Luis LaBoy still with us? I think he may have.
Here. No, I'm here, Steve.
Oh, very good. All right. Well,
thank you, Steve.
Yeah, go ahead.
Hi. Thank you, everyone. Good evening. Thank you for inviting me and allowing me to present this evening. My objective is to humbly request a resolution letter of support to expand our services at Emma L. Bowen Community Service Center. We're located on 145th Street and Amsterdam Avenue. We've been there for a very long time. We are also known as the Upper Manhattan Mental Health Center. We're actually providing services for all ages. We have a therapeutic preschool for children from 3 to 5 years old. These are children that have IPEs, and we help them, prepare them to go into public school. We also have behavioral health services for 6 to 21-year-olds. That's the child and adolescent program for behavioral health. And we also have behavioral health for adults, ranging all the way up. Our oldest client is 84 years old, currently on medication-assisted treatment. We have outpatient addiction treatment services, where we provide ambulatory detox for mild to moderate symptoms of withdrawal from alcohol, opioids, or benzodiazepines. We have a case management service. We have a psychosocial club for individuals with diagnoses with mental health disorders. And we have a pantry. We give out a pantry every Tuesday, Wednesday, and Thursday from 1 to 3 p.m. And that's open. Right now, we're providing services at the Addiction Treatment Center, both remotely and face-to-face. A very small number of people come in for face-to-face treatment. We provide services for individuals that are uninsured. That's something new. We just got granted by the federal government to provide services to individuals. We'll even pay for their medications. We're also an opioid overdose training program with the naloxone kits. This is the medication, the Narcan, that reverses an opioid overdose. And right now we want to expand our addiction services to help those vulnerable young youth and their family members that are marginalized right now with substance use disorders and suffering through trauma. And we want to expand those services in our facility. And at this time, we are applying for a federal grant. And that's why we're asking for the resolution letter. We know that the grant is due on Monday, and we won't get the resolution letter before then. But we want to continue with our efforts to expand services to the youth and their families suffering from substance use disorders and trauma. And that's what I got, Steve.
And the catchment area for this program would extend from where to where?
Well, we go to the South Bronx. We go all the way down to El Barrio. We go all the way down to 110th Street and all the way up to Inwood. So we have partners, community partners like Inwood Community Services and other organizations. We just partnered with Life is Precious, the suicide prevention for teenage
Yes.
girls.
Right.
We just partnered with them, with Columbia University, with Dr. Roberto Lewis. So we're expanding. We're letting people know that we're here and we want to help the community, provide them with the medicine that they need. And we're trying to capture the individuals that are vulnerable and are being, they're not getting the treatment that they need. We know there's a lot of people out there that are undocumented, don't have insurance, and are suffering right now from trauma, like most of us. And we want to reach out to everyone, including the South Bronx.
And this grant would enable you to serve how many more people? I mean, how many people? How many people are you serving now, and how many more people would you serve if you obtain the grant?
Right. So right now, with what we're doing now is 200. For this past year, we did 200 individuals. With the grant, we're gonna start with an additional 100 and doubling up to 200 for the second year and the third year, and it's for 5 years. So it's going to be a maximum of 1,200 people that we want to service, and we want to maintain the services. We want to be able to maintain viability. So once the grant is over, we can continue providing services to the community. And the other grant for the uninsured, that one is for 2 years right now. So we're trying to get as many as uninsured individuals that need mental health treatment, addiction treatment, including children and their families, and we'll also pay for their medications. So we want to do that as well for the next 2 years.
And that program would also encompass all of Washington Heights and Inwood?
Yes. Yes, I do outreach up in 181st Street as well. You know, I go out with the Washington Heights Corner Project. Usually go under the bridge on 181st Street to see the people that are homeless that need services down there. And we do a lot of outreach in the street, boots on the ground. We connect with schools and other programs, and we reach out to everyone that's possible. This is a one-stop shop spot where if we don't provide the service, we're going to find the resources for you to get your help. And I was telling you earlier that I got a referral from New York Presbyterian. Our oldest client is 84 years old. She was on pain management medication for 25 years. When her doctor passed away, she went into withdrawals, and she had no idea what was causing it. She had no idea that the opioids cause withdrawals. So she was she was hospitalized at NYP, the emergency room. And I get a lot of referrals from NYP, and I'm grateful for what they're doing for the community. And we were able to assess her and diagnose her. And we were able to stabilize her on Suboxone. So we prescribe Suboxone. That's another medication that a lot of people don't know it's available to the community. They're usually looking for clinics like mine to get Suboxone, and we do have it available. And this lady is doing great. She completed the program. She's on a very low dose with plans to discontinue the Suboxone, and she is extremely grateful. So we service everyone, all ages. You can't go wrong.
All right. And any questions for Mr. LeBoy?
Yeah, I have a question.
Is that Catherine?
Yes.
Yeah, go ahead.
Okay, thank you. My question, and it's, I guess I need a little bit more clarification. So the intent of the grant is to expand addiction treatment. Is it because you mentioned adolescents, so is it starting from 18 and up, and then, or 12. Is there a certain, like what's the population? For
12, we're looking at 12 to 21.
Okay, but is
12 to 20.
Mm-hmm. Sorry to interrupt you.
So we want adolescents 12 to 18, transitional age youth 16 to 25, with substance use disorders and co-occurring substance use and mental health disorders. That's what we're looking for. And we see that there's an increase right now with that in our community.
Right. And so, and you mentioned since y'all, so is it focusing only on opioid, or what other like substances are y'all targeting, or it's a grant for?
Very good. Yes, all substances. It includes alcohol, marijuana, cocaine, heroin, over-the-counter prescription medication, nicotine, even gambling. We address gambling, K2. So we're treating all substances and all mental health disorders as well. The reason why we're asking for an expansion is because right now I cannot treat 12 to 18. Right now I can treat only from 16 and up. And 16, I need parental consent right now. I will also need it with the grant, but I can go as far back as 12-year-olds.
All right, so that's important. What this grant will enable you to do is not just expand the numbers of people you serve, but would enable you to reach into the teenage group.
Yes.
12 to 18. And but when you said that the grant would enable you to serve an additional 100 in the first year, and then 200 more in each of the subsequent years, second, third, fourth, and fifth years.
Right.
Wouldn't many of those aren't going to be what's the word? These aren't going to be all. Are these all going to be new individuals each year? I mean, you would continue to serve. Let's say you get 100 new clients in the first year. Chances are you're going to continue to serve them up through the fifth year. Is that correct?
No, they will discontinue treatment at some point, and we have partners that we're referring clients to for continued care. We can provide continued care for any child or family member that needs it indefinitely. But what happens is that once we teach them how to become self-sufficient and independent and develop some goals, completing, school and developing support systems within the community, which we do have many support systems in our neighborhoods, and we're partnering up with them. But so they will come, stay with me 3-6 months, maybe a year. Everyone is different. But our goal is to address and treat 108 for the first year, and then after that, we're going higher to 200 and possibly even more, depending on the need. We're just going to continue to expand and continue to hire staff. So we're looking at. Go ahead.
So we could be talking about 900 or more separate individuals who would be benefiting from this grant.
Yes. Yes. And now more than ever, because we see that there are a lot of individuals that are scared to come into treatment, don't have insurance. There are a lot of undocumented individuals out there that don't know how to seek help, get help, and we want to guide them through the process. We're not going to deny services to anybody. It was very difficult for us to verbalize helping undocumented people due to the past administration. But moving forward, I think it's going to be easier for me to be able to address these individuals and verbalize it openly. So for now, I just mentioned uninsured.
But when we talk about 900 or more individuals who will benefit from, is it from one grant or from both of them?
Both grants. It depends. Most people right now, most of the kids are suffering from trauma. So we're providing trauma-informed care.
All right. So these two grants basically would be to serve a joint population.
Oh, yes, it can be separate as well. They can just have a substance use disorder, but we're still going to address the mental health and the trauma and see how severe it is. So we take them all. Either they are coming in just for trauma, or they're coming in just for substance use disorders, or they're coming in for both.
And the grants would come from which agency?
SAMHSA.
What is that?
SAMHSA is the Substance Abuse Mental Health I would have to Google it to give you a correct answer, Steve, okay?
That's a state agency, I think. No,
It's federal.
SAMHSA. Yeah.
Yeah, Sam says the federal grant. It's the Substance Abuse and Mental Health Services Administration from the feds.
Okay. Any other questions from the committee? Does anyone want to move a resolution?
I think my instructions were that I might have to present to the full board.
No, it wouldn't be necessary.
Oh, good.
Steve, I'll make this is Betty. I'll make a resolution that we support the efforts of the Emma Bowen Community Center to provide, we support their effort to obtain a grant to expand mental health services in the community.
Excellent. Thank you.
Is there a second?
I'll second it, Steve. Tanya.
Is that Tanya?
Yes.
Okay, very good. All right. I think I'm going to have to call the roll. Betty?
Yes, I'm supporting it.
Okay, Tanya? Tanya, how do you vote?
Can you hear me?
Yes. Darrell?
Yes.
Catherine?
Yes.
Sally?
Yes.
Barbara?
Yes.
Osi? Oh, is Osi still with us? Jay? All right, and I vote yes. In consideration of the fact that Emma Bowen once lived on my block and was once a member of Community Board 12, and I knew her fairly well. I support this. So that's.
Hey, Steve. Sorry, hold on. Jay's muted, I think.
Why did you do that to Jay?
I did not do that. Someone else did that.
No one can mute him. He has to unmute himself.
But no, he wasn't before. I don't know who muted him because he's on the phone.
Oh.
I'm voting yes, although I'm not a member of the committee, but I'm a member of the board.
Yes. Okay, that's true. Yeah. Thank you.
He's not muted, and Darrell, you're a co-host, so you can try to unmute him too, even though he's not muted. That must be something on his side.
I'm trying, but it says it sends a request. It's not just unmuting him. I don't know why.
All right.
Can you hear me now?
Who is that?
Osi.
Yeah, I can hear you.
Yeah, Osi, how do you vote?
I voted yes. I just want to say that when you do the *6, it doesn't hold for too long, so you can't talk. Jay, do it again.
She's saying do *6.
*6 is for talking. It's the WebEx thing. It's
If you're on the phone,
the
yeah.
life a little more. So if you want to talk, you have to press *6 if you're on the phone.
All right. Do we have any other board members besides Maria? Richard, are you still on the call? Richard?
He's still on, but he may have stepped away.
All right. I'm gonna say the resolution passed. Luis, I'm gonna have to be in touch with you when I sit down and try to write out the resolution, so I know. So I'm sure that I know what I'm writing about.
Yes, sir.
All right. So I probably have your phone number for one of the emails.
Email and the phone
Okay.
number. My cell phone is on there.
Okay,
I'll
very
send
good.
you whatever information you need.
All right. I'm gonna need a little bit more probably. All right. Very good.
Thank you very
All right.
much, Maria.
All right, thank you. Okay, next item is the New York State Nurses Association. Is Anthony Ciampa still with us? Anthony?
I don't see an Anthony on the screen.
Okay, all right, he may not have made it. Okay, old business. The corner project has apparently signed a lease for a permanent location in Washington Heights. They're going to hold an open forum to the community in 2 weeks, which they will formally announce the space. As soon as I get the details of that meeting, I will pass it on to other members of the board so that we can all join in and get the information about their new location. The DEP service request, I forwarded that to the members of the committee. There were 196 service requests from the Washington Heights Inland community in the month of January. The number one complaint again was construction noise before and after hours. And the second, that was 25 complaints. Noise from alarms was the second most common complaint, 17. And then there were 16 requests for lead testing kits. The street and sidewalk cleanliness ratings for the month of December. Our committee was at 90.4% on street cleanliness and 96.3 on sidewalk cleanliness. I also forwarded to you the reports, the report from DDC on the project to replace gas mains and install sewer lines, water mains in the area largely east of Broadway between 170th and 189th Streets, 190th Street. That project is now at the 48.75% completion stage.
Hey, Steve.
Yeah.
Under old business, I
Yes.
think Natalie wants to talk about some misdirected mails she must have received.
Okay, Natalie, are you on?
I am on, Steve. Hello, Health and Environment Committee, and all of their special guest stars. It's like being on the love boat for this committee. You know, you just have all these people who come in, and it's some new people every month, but then there are, you know, the ones that are the standbys. No, I did just want to say that I did get my ARP card this week. So to people saying that there were folks in line that may have looked too young to be in line, it's just that, you know, we Northern Manhattan types, we age well. But I did want to.
Are you serious? Are you 65?
No, I'm not 65. I don't know why I got that card.
Okay. Well, actually,
but I'm getting there, Steve. I'm getting close. I'm getting close.
Maybe they send it to people 55 and above.
I think they do. Yeah. Or either
You
that, or that's how you
were hacked.
Or you could. You know, that's the cutoff for Senior Jeopardy. I don't remember which, but
okay. Okay.
But I did want to update folks real quickly. I mean, we did have to call out for snow our test site with Word Up, but we will be there, rain or snow, this Tuesday the 9th, noon to 4. So that's Word Up Books, 2113 Amsterdam at the corner of 165th Street. It's the self-test, so the staff will hand you the swab, you swab yourself, return the swab, and you get the results in 2 to 3 days. When I have done it at this type of site, I've gotten it, and it's usually 1 to 2. Volume may be going up now. But I also wanted to say that the borough president had held the second Manhattan Vaccine Task Force meeting. I won't go into the details of that report because I think a lot of it are the concerns that you heard today from people with, frustrated with the long waits, the not so user-friendly technology to get on. And some of the things that were being brainstormed at this week's meeting were how New York might model the way some other places in the country have at-home vaccinations for the homebound folks and other expanded categories. So if you have anything you want to pass along to the vaccine task force, again, these are stakeholders from across the borough that we put together particularly to try to collect some of these concerns and brainstorm some possible proposed solutions. But please do send them my way, nespino@manhattanbp.nyc.gov. And while you are writing to me, if you'd also like to inquire about getting involved and joining the community board, Manhattan Community Board applications for new applicants are due February 22nd. Anybody who attends these meetings can tell, you won't have a better time anyplace else. You will make a difference. And now in particular, we have a lot of public needs in this district to respond to. So it's all hands on deck.
All right, very good. Bernard, are you still on the call? Bernard? Bernard, if you're on the call, Word Up is another testing site in the community. It's even closer.
Steve, I don't think he is, no.
Okay, fine. All right. All right, thank you, Natalie. Okay, under new business, President Biden announced the other day that he's going to reopen the enrollment period for Obamacare, which our previous president had tried to choke off. So I believe the enrollment period is going to run from sometime in February for another couple of months. As soon as we get the details, I'm going to ask the community board office to send it out so that people know that they have a chance once again to get health coverage. Any other new business? Did someone say something? All right, very good. Under announcements, I also forwarded to all the committee members a calendar of events from the Herbert Irving Comprehensive Cancer Center. So check your emails. I also asked the community board, Paola, I also sent it to you and to Ebenezer and Chanel. Hopefully the committee board can also send that out to our list. Are there any other announcements? Okay, very good. All right, I believe we can now adjourn the meeting at 9:08 p.m.
Can you hear me?
Who is that?
Yeah, now we can.
Oh, with this WebEx. I have another new business, but it's not that new.
Is that OC?
Yes.
Okay.
So in terms of the electronic recycling, since the Lower East Side Ecology Center closed down, do we know who's going to take over the electronic pickup, the recycling? And if we know who is going to take over, can we get, a calendar? Can we get dates for those? And I had another issue which I put in my email and I forgot where it was, and I'm not at home.
See, they haven't shut down. They're not doing them now, but they have not stopped doing them. They just haven't put out a calendar. They had one scheduled right before the COVID hit. In fact, there was
but there is a problem. But we have a problem. Steve, can we invite them? Here's the problem. I mean, for years, we only had one a year. Once a year, we had one event here in Isham, and there was nothing in Washington Heights. No event.
Yeah, we've discussed this. We've discussed it in the past. Yeah, it's a problem.
Well, it's a problem because, there is no appearance over there. Nobody knows that even exists. So, I mean, we really have to have those events in Washington Heights.
Yeah,
and
they tried one a couple of years ago. It wasn't very well publicized, and I spoke to them about trying it again, and I could get back in touch with them.
Right, because just trying it once is not good enough. I mean,
I
that
agree.
has to be
I agree.
like, okay, so I'm sorry, I'm maybe preaching to the choir here, but you know, it's absolutely outrageous. That there
No,
was,
they were,
you
I mean,
know,
they were all ready to go before COVID. In fact, they had agreed to do a second pickup at Dykeman houses. So,
yeah, I mean, like, I'm kind of sick and tired of all this COVID excuses because it's an outdoor event. So, I mean, there is no reason not to have it and back, and absolutely must have them in Washington Heights. And so, Steve, if there is a way to get them back, I mean, get them on the agenda sometime in the next month or so, and get some answers from them, because this is so wrong on so many levels.
Okay, I hear you.
Steve, it's Barbara.
Yes, Barbara.
I'd like to comment. I think one thing we should promote as a community board is that through the Department of Sanitation, you can sign up your building to have its own e-cycle bin, and also for your own bin for clothing and textiles recycling. And they will Housing Works comes and picks the stuff up, or sanitation comes and picks the stuff up. In my building, 99 Hillside, we have both e-cycle and textile recycling, and they come on a regular basis and pick the stuff up.
Yeah, the committee board, we have to do more to promote it. Yeah, we did have a presentation, remember, was it 2 months ago from Katie Hanna from the Solid Waste Advisory Board, and she touched upon this, and and she did send me some material which I should look at. So yeah, let's.
So and also my other question. I'm sorry, Steve. I just remember what it was. The textile recycling in the farmers market. When is it going to come back? It's an outdoor event.
I thought they were still doing it.
No, it's not back. That's the problem. It's absolutely not back. I mean, can we get somebody from that? Yeah, somebody to talk to us next month.
Yeah, let me try to do that, or at least get an answer by the, so we know when it's coming back.
Okay.
You just have to look. Everybody should look. Just Google e-cycle New York NYC, and it comes up under the Department of Sanitation website.
Barbara, I get it, Barbara, but we have to be in front of people's face. That's the thing. Otherwise, it's not going to work. Nobody is just like, I want to recycle this today. Let's see how I do it. No, it has to be in front of them.
Does your co-op have this set up, OC?
We do have a setup, yeah. And we do recycle our own bulbs and batteries that nobody else is doing. So we do that.
Okay.
Yeah. But we have a green committee here, and I'm a member of it. So, Anyway.
All right, and welcome to our committee. I forgot to acknowledge this is your first meeting as an official committee member.
Thank you.
All righty. All right, anything else? Is there a motion to adjourn?
Motion to adjourn.
Second.
All right, it passes unanimously. Okay, the meeting is adjourned at 9:13. Okay, thank you all.
Good thing we started a half hour earlier, huh, Steve?
Yeah, maybe.
Thanks, Steve. Good job.
Good night.
Daryl, I was very.
Thank you, Maria.
The last WebEx, hopefully.
Hopefully. What were you saying, Steve?
I was very nervous that I was on time, but you weren't. And we were worried about getting a quorum until you showed up.
I would have been. I had computer issues at the beginning. I always look for emails that say panelist. That's the easiest way. But they weren't sent this way that time because of WebEx.
Yeah, they threw me off. So should we insist on having Zoom next time?
Well, the Borough President's Office had a meeting last week where they discussed with the district managers of how to do 2 Zoom meetings at the same time. I guess it can be done. But the office just needs to figure it out, I guess.
Yeah. All right, let's check with Ebenezer. All right, thank you all.
Yeah. Good night.
All right,
Good night, everybody.
all right, take care. All right, bye, Maria.